Thank you very much, Ian, and congratulations on your term as chair. You've done a wonderful job. And I'd also like to congratulate Duncan on his appointment and wish him all the best. I look forward to working with you in the months and years ahead. I'd also like to acknowledge special guests amongst us and the board of Pain Australia. Thank you very much for the invitation today, and also especially acknowledge both Carol as the CEO, but also David as my co-chair of Parliamentary Friends of Pain Management. I do note that I have to leave. I feel very embarrassed that I have to walk out at 2:30, but I have a plane to catch back to Tasmania, and it's the last opportunity to get home tonight if I don't go when I leave. So it's my honour to join you here today to launch Pain Australia's updated National Pain Service Directory on the same day that Minister Greg Hunt has launched Australia's National Action Plan for Pain Management. These important initiatives go hand in hand, so I'm very pleased that they are being launched together. As you're aware, almost 3.4 million Australians live with chronic pain, including some of those joining us here today, both online and in person. They know how chronic pain restricts activity and impacts their day-to-day lives. They know how chronic pain can determine whether they can go ahead with their plans for the day or whether those plans will have to be put off until a time when their pain is more manageable. And they know how chronic pain impacts their work, health, sleep, relationships, as well as creating all the flow-on effects for families, carers, friends, colleagues and wider communities. So through the Parliamentary Friends of Pain Management Group, David and I have worked hard to raise the awareness of chronic pain and managing that pain with MPs and senators in Parliament, and acknowledge that some are online, and also within our own communities. One pain management initiative we've been promoting is the National Pain Services Directory, which was officially launched initially, I think, in 2019.
Yes.
The new and improved Pain Services Directory contains information on services offered by more than 200 facilities throughout Australia. This directory puts the information about pain management services and facilities in a format that makes it easy for consumers and GPs to find what they need. And I acknowledge the man behind it, sitting over here. I think you've done a wonderful job. The directory search function allows people to find clinics by state and territory or by a specific geographic location, by pain condition, or by whether a public or private facility is needed. It means those living with chronic pain, their carers and medical professionals can make informed decisions around pain management options and pathways located in their regions close to where they live or work. As I said earlier, the National Pain Services Directory and the National Strategic Action Plan go together. These initiatives give Australians living with chronic pain the access to the care and support they need. Pain Australia was tasked with the development of the National Strategic Action Plan for Pain Management with financial support from the Australian Government. The result released here today is an action plan that lays out a national approach towards support for chronic pain management and has been endorsed, as mentioned earlier, by health ministers from every state and territory, which is no mean feat. The National Strategic Action Plan for Pain Management outlines the key actions Australia should take to tackle chronic pain, including managing pain through holistic methods. The plan recommends 8 goals that focus on reducing the burden of disease, improving the quality of life and care for patients, educating Australians on understanding and managing pain, and supporting health practitioners to deliver the best treatment and care for pain patients. As detailed by the Minister, the Australian Government is providing $2.5 million for early implementation of this plan, including funding to educate and train health professionals in offering effective pain management care, as well as providing further funding to Pain Australia for consumer education and awareness programs. Chronic pain costs the Australian economy more than $70 billion each year, but the cost of persistent pain goes beyond economics to quality of life. The updated National Pain Service Directory and the National Action Plan for Pain Management give us tools and future direction in the support we provide for Australians living with chronic pain. So thank you very much for the opportunity to be here, and just so excited to officially launch the updated version.